Today's presentation will be in this order. And first, I'll talk about the research objectives of our research project. Currently, there are two major challenges that need to be solved in Korean medicine. One is improving public trust in Korean medicine, and another is the need to reduce in medical expenses. Due to insufficient scientific evidence for the safety and effectiveness of Korean medicine and low public trust in service qualities, there is generally low public trust over Korean medicine. And because of low health insurance coverage rate for Korean medicine, there are very limited number of health insurance benefits coverage items of Korean medicine. And also non-reimbursable services are mostly very expensive, which results in an increase in national medical burden. Therefore, our research objectives can be summarized into 3 points. 1, improve public trust, and 2, improve in the service quality, and 3, reduce in medical expenses. However, low public trust or insufficient quality in the services are not due to the ineffectiveness of Korean medicine. Rather, lack of efforts such as investment of research funds from the government make it difficult to provide sufficient evidence. Accordingly, our research is an attempt to overcome these problems. Due to recent changes in the medical paradigm and stagnant growth, innovative research method called translational research is emerging, connecting basic research and clinical field. Through this, the quality of medical services can be improved in line with the changes in the medical paradigm, which can lead to improved profitability of medical institutions. In addition, by reducing medical costs, it can contribute to improving public health. As a part of government-led practical clinical research, this project seeks to conduct comparative effectiveness of research including practical clinical trials, observational studies, and systematic reviews. If economic evaluation is included, a technical evaluation becomes possible. After that, this will become the basis for developing clinical practice guidelines, which is called the CPGs, and the developed CPGs can be disseminated and spread to local doctors and hospitals and become the basis for the institutionalization. Therefore, in this study, we plan to conduct clinical research to evaluate effectiveness, safety, and economic feasibility of the technology for institutionalization entry. And we plan to expand the evidence for the techniques which Korean medicine has strengthened through clinical trials, systematic reviews, and meta-analysis. Further diseases or interventions that are not suitable for randomized controlled trials, we plan to conduct prospective observational registry study. So let's go on to the selection backgrounds for the key diseases. Our project has selected degenerative joint diseases as a key disease, and specifically degenerative knee osteoarthritis and adhesive capsulitis and shoulder pain diseases. Why degenerative joint diseases? In general, these diseases are most frequently occurred with the aging population in the modern society. And these diseases are mostly chronic with no clear treatment method to overcome, causing a lot of socioeconomic costs. And from the perspective of Korean medicine, they are one of the healthcare priorities with high treatment demands at Korean medicine medical institutions. And also, Korean medicine has accumulated quantitative and qualitative clinical experiences of these diseases. So if we go through the reasons one by one in detail, you can see in the picture that the number of patients and the annual medical expenses increase every year related to degenerative joint diseases. and arthritis, one of the major diseases, ranking second of the chronic diseases in the statistics from 2017. And for knee osteoarthritis, it is a frequent occurring joint disease, which accounts for over 80% of the degenerative joint diseases. And artificial joint replacement surgery, which is a final step of treatment for degenerative arthritis, is increasing with the absence of prevention and treatment technology. For shoulder joint diseases, it shows a rapid increase in the number of patients and average annual medical expenses. Here you can see it has increased significantly the frequency of occurrence with the diseases of hospitalization from 2010 to 2017. Among shoulder diseases, adhesive capsulitis is the most common shoulder disease, with rotator cuff disease coming second. Although the number of patients with frozen shoulder remains relatively constant, the medical expenses due to frozen shoulders are steadily increasing, which arises the need for the development of treatment technology to reduce medical expenses. Over 70% of Korean population have experience of Korean medicine, mostly with musculoskeletal disorders. Major diseases include arthritis, frozen shoulders, and shoulder pain diseases. And major areas that patients are requiring for improvement is the expansion of health insurance coverage, ensuring the safety of herbal medicines, and smoothing cooperation with Western medicine. Regarding joint diseases, the diseases related to knees and shoulders show the highest demands with the collaborative medical practices. Among knee diseases, knee arthritis accounted for 72%, and for shoulder diseases, frozen shoulder and rotator cuff diseases accounted for the highest proportion. With accumulated clinical experiences, Korean medicine clinical practice guidelines for knee pain and shoulder pain were published in 2017 and 2019 each. From CPGs, we found out that the evidence for different types of acupuncture, manual acupuncture, electroacupuncture, and pharmacoacupunctures are sufficient, but evidences for herbal medicines and other interventions are inadequate. In particular, there is some lack of evidence for new medical technologies that are highly demanded by patients, for example, thread embedding acupuncture. Next, let me introduce how we plan to proceed with this research in detail. For degenerative arthritis, when structural deterioration occurs, the ultimate treatment choice is the surgery. From early arthritis to grade 3, drug treatments such as NSAIDs, including coxetine inhibitors, is usually the main treatment. There are high demands for non-surgical treatment, but there is no clear proven method. For patients of grade 2 and 3, in Korea there are natural medicines made from herbal medicines, for example, Leila, Shimbaro, and Join's tablet, which have been developed and widely used. However, due to the development process and medical system of Korea, Korean medicine doctors are not limited to the use of these medicines. Therefore, verification of effectiveness of effective treatments accumulated in Korean medicine clinical fields is highly demanded. When specifically looking at the progression of knee osteoarthritis, grade 2 and 3 is the period when non-surgical treatment is required, mostly focusing on the pain relief and the delay of the progress. So we're trying to establish evidence to expand coverage of effective treatments with herbal medicine Tokhalgisingtang, which is proven to be effective in basic research. And since prescriptions of Korean medicine are based on the pattern identification, we judge that clinical trial reflecting this reality is needed. Accordingly, research on herbal medicine kami 대강알탕 is planned to take into account the cold hip patternization, which is the most commonly used among local Korean medicine doctors. For shoulder diseases, Western treatment has focused on the drug therapy for acute inflammatory diseases or surgeries to restore damages from trauma. For chronic shoulder diseases or rotator cuff diseases, there is no effective treatment available other than painkillers or exercise therapy. In actual clinical fields, the clinical effectiveness of Korean medicine treatments, including herbal medicine and different types of acupuncture, for shoulder diseases are evaluated as excellent, but the evidence established through clinical research is insufficient. As mentioned earlier, it was confirmed from the CPGs that pharmacoacupuncture and tuna treatment for shoulder diseases have been already verified. But additional evidence for treatment technologies with strengths are needed. There was an RCT on chronic rotator cuff disease with red embedding acupuncture, but it did not show as much effect as expected. Through a literature search, we selected that frozen shoulder will be more suitable for thread embedding acupuncture research. For various shoulder diseases that cause shoulder pain, we also planned a registry study to collect and analyze the effect of various treatment techniques. So let me summarize our project's clinical trials. There are 2 RCTs using different types of herbal medicines to enhance health insurance coverage for knee osteoarthritis, and 1 RCT using thread embedding acupuncture to establish evidence for intervention technology which Korean medicine has strengthened. A 1 prospective observational registry study for various shoulder diseases are planned. The current status of these clinical studies is as follows. RCT using 독활기생탕 is a multi-centered, randomized, and assessor-blind test dividing patients into 2 groups. Patients taking herbal medicine and Western medicine. Because it has been just begun, it's 5% in progress. Another RCT using kami 대강알탕 for knee osteoarthritis is similar but a little bit different. It's also multi-centered, randomized, and it's a double-blind test, dividing patients into 2 groups. Patients are taking herbal medicine and placebo. Because it's the first RCT using kami 대강알탕 against humans, we had to acquire IND from the Ministry of Food and Drug Safety. And the recruitment is scheduled to start within this year. As a study on new strength technology, we planned an RCT for patients with frozen shoulders. It's a multi-centered, randomized, and double-blind test, dividing patients into 2 groups. Patients receiving thread embedding acupuncture group and sham group. The recruitment started last year and it's about 70% in progress. Also, we plan to conduct systematic review and meta-analysis for RCTs of thread embedding acupuncture for musculoskeletal disorders such as degenerative arthritis or frozen shoulders. For registry study, we have firstly developed disease-specific registry system as a mobile application which can be used on mobile tablets. Using this, we are conducting clinical research of a registry to establish evidence for the effectiveness and safety of frequently used interventions for shoulder pain diseases through a prospective observational study. We have also developed a mobile application designed to have self-management tools and clinical research tracking system considering disease characteristics. We have verified the feasibility as a comparative intervention for daily management programs through preliminary research. And we are trying to establish the evidence for the developed application by applying it to a multifaceted clinical research. In the future, we hope to achieve the registration of health insurance by deriving a prescription for knee osteoarthritis that has completed the evaluation of clinical effectiveness and safety. Since research system has been established through various clinical trials mentioned earlier, it is expected that in the future we can co-research with other parts of the science. For example, multiomics using Human derivatives or zebrafish research for screening pharmacoacupuncture effects will be possible. More information about these topics are prepared by the following speakers. Thank you for listening.